Okay, so I'm here with my patient who has right femoral acetabular impingement syndrome. So we've already assessed that this patient has decreased internal rotation specifically, but all around decreased range of motion at the hip with pain. So we're gonna go through some joint mobs today to increase range of motion for this patient. We wanna make sure that the joint mobs do not increase pain or cause the patient any pain. So with any joint mob, you want to make sure that you communicate with your patient what the goals of the treatment are, as well as what they should expect. So today I'm going to be doing joint mobs on your right hip. The goal of this is to increase your range of motion at your hip, which we've already assessed is a little bit decreased. Also with this, I don't want you to feel any pain, so if at any point you feel pain, I want you to let me know. There might be a little bit of discomfort just because we haven't done joint mobs before. And then another thing is that this belt is going to be placed higher up in your groin hip area. Are you comfortable with that?
Yes.
Okay, so with any patient, you want to make sure that they're aware of the placement of the belt. Especially with male patients, you want to make sure that they're in a position that's comfortable for the joint mob to take place. So I'm going to go ahead and ask you with your left hand to please move your privates to the side. And again, I don't have my mulligan pad or belt, so we're going to improvise today. I'm going to use the towel for padding, and I'm just going to instruct my patient. I want this belt to be as high up into your groin hip area as possible. So I want it to lay about right here, okay?
Okay.
So I want you to just position that for me. So get it high up into that position.
Okay.
All right, so I'm going to clip the belt here at the bottom. And if I did have a mulligan belt, I would be able to step all the way through it to my hips, but I don't. So I'm just gonna step through it with my leg, get into position. Is the belt still in the same spot?
Yes.
Okay, perfect. Now I'm gonna get the patient into about a 90-90 position, and I'm gonna sit back on the belt to increase some distraction here. So this is a direct distraction, lateral glide of the hip. Do you feel any pain at this point?
No.
Okay. Now I'm going to put the patient into some internal rotation. Any pain?
No.
Okay, so I met my point of resistance, so I'm just gonna sit here in this internal rotation, and I'm gonna lean back on the belt, and I'm gonna rock back and forth to resistance and out of resistance. So this is gonna be a grade 3 hip mobilization, specifically to increase internal rotation. Any pain with that?
No.
Okay. So we would do the joint mob for about 3 sets of 8. Depending on the patient, if this is phase 3, we're going to go with 3 sets. Phase 2, we're going to go with 2 sets. And then we're going to reassess with goniometric measurements to see if we were able to increase internal rotation. Okay, so now we're going to get into some mobility for our patient with FAI. So this can be performed in phase 2, 3, 4, 5, at any phase. This can be used as a prevention. At this point, it's going to be used as a rehabilitation mobility exercise. So this is called hip CARS. Pretty much, we're going to be taking the hip through all of its articulating surfaces at the acetabulum. So the patient's going to begin in a quadruped position on all fours. And you want to cue the patient that their back is not arched. So you want to make sure they have a flat back. So they're going to begin, because our patient has right FAI, they're going to do this, they're going to do it on both sides, but for demonstration on their right. So the first position, the patient's going to bring their right knee to their right hand. Then they're going to bring their knee towards the inside. And then kick up to the ceiling. And then go into a fire hydrant and all the way back around like a donkey kick and bring the knee back down to the center. Then they're going to reverse and they're going to donkey kick and bring the hip all the way up around, fire hydrant, and then drop the knee down, inside, and back down. So they're going to do that revolution. That was 1 revolution. They're going to do it 3 times on each hip. So this is going to increase mobility at the hip, and hopefully we can increase some range of motion for our patient with FAI. So here's going to be a strengthening exercise specifically for the glutes, even more specifically for glute max. So we want to increase strength of the hip musculature. So these are going to be banded hip extensions or donkey kicks. So I'm going to have the patient go ahead and get into a quadruped position. So it's going to be on all fours. And then here again, you want to make sure that the patient is not arched back. You want to make sure they have a flat back, and they're going to be engaging their core throughout the exercise. So they're just going to, so again, the patient has banded around their knees. And with the right leg, you're going to go ahead and kick the ceiling above you. All right, and you want to make sure that your hips don't rotate out. So if you have to not kick as high, that's okay. I just don't want your hips to rotate out, okay? Go ahead and try it again. Perfect. So you see the hips stay more aligned, and that's the position that we want for the patient. So it's going to be 3 sets of 10 for this exercise, and we can progress with the isometric hold, we can progress with perturbation, and we can progress the donkey kicks in several different ways. Okay, so now we're going to get into a strengthening exercise for our patient with FAI. So this can be performed at phase 2, 3, or 4 of rehab. We would just progress the patient through a different series of progression. So first, this is going to be a single leg glute bridge with adduction isometric hold. So pretty much the patient can first start with doing a glute bridge in phase 2, but we're going to be doing this in late phase 3. So we're going to introduce the adduction isometric hold. So the patient's just going to go ahead and perform a glute bridge, just so I can see. So go up with both legs, go ahead and do a glute bridge. Perfect. Now I want you to relax. Now I want you to lift your right leg off the ground and extend your knee, and go ahead into a single leg glute bridge. Perfect, and relax. So that would be the progression for this patient. I'm going to actually add the adduction isometric hold. So pretty much we're going to put the band around the right leg and go ahead, bend this knee, go up into a single leg glute bridge, and I'm going to be pulling the patient out, and they're forced to isometrically hold the adductors, and they're going to hold this position for 30 seconds. So go ahead and get your hips higher, perfect. You're going to hold it for 30 seconds, and go ahead and relax. Okay, so as you can see, we can progress the glute bridge from both legs to single leg to adduction hold, and in different angles to progress the patient.